we've been talking about Ozempic. You go on the freeway anymore, and there's billboards up that advertise weight loss, and we've heard about it in social media. So I want to ask questions that I think a lot of our patients have about these medications, and hopefully shed some light on what people should understand about these weight loss medications. Dr. Bowden, you talked at Sundance and said that one size does not fit all when it comes to these drugs. What did you mean by that?
So this can be an amazing tool for some people. Mm-hmm. If you have someone who is diabetic, especially who is dealing with obesity, they have a really hard time managing their eating, constant cravings, that voice in their head that says, I need something to eat, I need something right now. This can be a really powerful tool for them to be able to have a medication that just helps push them into a place where they can feel like, okay, I have a little bit more control. That appetite is cutting down a little bit. Those voices in my head are calming down. I can make some healthy choices. I can get my blood sugar under control. And that can be fantastic. On the flip side, we have people who maybe just need to lose some weight, and they don't really eat a lot. They are exercising. They are doing all of the things that they should be doing. Those voices are not in their head. Those medications really don't do anything for them. It's not the right approach for them. And maybe there's something else that's causing their weight challenges. But recognizing that we have different tools for different types of people, I think is an important thing to consider.
I really like that, because the advertising suggests that one size does fit all. Mm-hmm. That this is the drug that everybody should take if they want to lose weight. And your message was some patients benefit from it and others don't see the results that their friends had and get discouraged by it.
Mm-hmm. They do.
What side effects should people know about when they're thinking about taking Ozempic or other medications like it?
So I like to educate patients that what Ozempic can do is it can slow down the digestive tract. And so educating to them that they should be cautious of their water intake because it can cause constipation, obviously, nausea, vomiting, blood pressure issues. So they should be careful, fatigue, those kinds of things are all common side effects with the medication. So that's what I like to educate to.
Mm-hmm. Any other side effects that people should know about?
So there are some kind of severe potential long-term side effects that aren't super common, but that can happen. And so people should be aware that that's a possibility. For example, gastroparesis, because it does slow down that digestive tract, it can also slow it down too much and become more of a permanent situation. There's increased risk of cholecystitis. There's increased risk of having, if you've got depression and anxiety, it can potentially increase suicidal thoughts. And so being aware of individuals who are having mental health challenges, which is honestly kind of common if we're having weight challenges too, or other issues that are going on, but recognizing that that's something that maybe you need to be a little cautious with and have some extra support.
That's really helpful. What about how long to stay on the medication? Is this a short-term thing where you lose some weight and then discontinue it, or is this something that patients stay on long-term?
I've seen both situations where people can go on it short term. I think the most important thing here is that you're creating those habits. It's not going to just fix everything. You've got to incorporate it into a routine. So using it in combination with exercise, changing your diet habits. I think people who really can do that are going to be able to come off the medication quicker, maybe do it for a few months, see where they get, and then use those habits long term. Where although I also have seen patients who go on like a maintenance dose. And I don't know if there's a right or wrong to it, honestly. I think it could work for either or, but really the goal, I think, is to change the habits while you're on the medication if you're going to be using it.
I would agree that it's making those long-term lifestyle changes that makes that long-term impact, and having a tool to help you get to that point can be really helpful. But taking it as I'm just going to take this medication and then I can eat whatever I want and I don't have to do anything, isn't the right answer, because then you're either stuck taking that forever or you're going to gain the weight back.
I like that. I like thinking about it as a tool. And I love the idea of having someone counsel with you as to whether or not it's an appropriate tool for you, given where we see its benefit and where we don't see benefit. And then having an appropriate conversation around side effects and the downside, because virtually all medical treatments have side effects, and it's important to recognize that. And then I really like thinking about it within the context of an overall plan. It's not the only thing that you're going to want to do to be as healthy as possible, but it could help you and could help spur some progress and incorporate some additional things along the way, better habits, better eating, better exercise, and end up getting better results as a consequence. So I think that with all of the new drugs that come out and the new procedures and things, it's really important to recognize that all of these things sound great or might sound great. They're being advertised because somebody's making money on them. And we just want to help our patients recognize where a particular treatment has a place and counsel with them on appropriate use, the downside, and not just think about it as one treatment, but the whole array of things that incorporating behavioral changes and lifestyle changes, exercise, trying to eat a little bit healthier. Maybe a surgery is helpful in the context of that, or some physical therapy or a pain medication, and that's how we best help our patients get better.
I love that.
I agree.